Gastric stasis, okay, which is the common cause why many of our patients that have feeding tubes aspirate. Why? What happens? Okay, in patients that have malnutrition or very advanced disease, the gut stops working. It's not squeezing as well. The body starts to shut down. They may be on narcotics, other medications that impact the gut. So if there's a feeding tube put in, okay, and the tube feeding rate is normal, they're at greater risk for it coming back up because the stomach is not going to squeeze it on down. So we're going to talk about also looking when you're doing your modified barium swallows. Will the physicians, the radiologist, allow you just to scan down to look at the esophagus? Or even looking to see, again, doing a close watch on the albumin levels, their other nutritional state. I work a lot with head and neck cancer patients, and many of our head and neck cancer patients that are severely malnourished, gastric stasis is very, very common. And I think in terms of the yeses, I think all of us see many times in the course of our practice when the nurses may see a patient, what do they tell every patient to do when they're eating? Tuck their chin, right? If, once they're seeing the patient, they see coughing and choking, what do? Tuck your chin. We know from research that only helps about 60% of patients. If a patient has material hanging up in the piriform sinus, what does a chin tuck do? Actually worsen or cause greater aspiration. So that's an example that I like to use with my medical providers if we feel the need that an instrumental assessment is necessary. And basically, as these patients performed the supraglottic swallow maneuver, their cardiac status was monitored while they were doing the swallowing therapy or other therapies or eating. And what they found is that the greater percentage of the stroke patients, 87% of them, had some cardiac findings when they were doing the breath hold technique. But those cardiac tracings went back to normal after they stopped the swallowing therapy, and it didn't carry over to other physical activities. The orthopedic problems patients did not have any cardiac findings. So what is the take-home point? Basically, if we've got a patient that has had an acute stroke, fairly still in the acute stage, coronary artery disease, and so on, we probably should get clearance from the physician or make sure that there's cardiac monitoring during the technique initially on. And again, the more that we have patients do complex instructions for longer periods of time, the less compliance. I love this study. A group of investigators in '86 worked with geriatric patients with swallowing problems, and they worked on swallowing instructions and therapy for a short period of time. So they said to the speech pathologist, okay, after the end of this treatment program, I want you to estimate how many of the patients are going to comply with your recommendations for safe swallow. They said, 72%. What was the actual compliance? 35%. And I think we all see that every day. So what can we do to improve the adherence and the compliance?